County residents and all of our listeners in the Upper Cumberland today. On beautiful mornings, on the first day of fall, we're oftentimes lulled into a sense of security, and we oftentimes forget the crisis that is still at hand. To do a quote from Winston Churchill, "This is not a time for ease and comfort. It's a time to dare and endure. Difficulties mastered are opportunities won. Success is not final, and failure is not fatal. It's the courage to continue that counts." As we all know, our daily challenges continue every day with this COVID-19 pandemic crisis at hand. Proven leadership has brought us to where we are today in this battle against this unseen enemy. But Americans are resilient. We have done it in the past, and we will continue to do it again and again and again. And this crisis is no different. We are America strong. We are Tennessee strong. Today, we welcome to the BLTV program Tennessee Governor Bill Lee. If anyone knows the burden of leadership during a crisis like we have now, it is certainly Governor Lee. Governor, thank you for joining us today. And we hope you are doing well and your family as well. And we know the crisis at hand has put much of a burden on every elected official from the national level all the way down. So today, if you would like to give us a little update on how the last 7 months has kind of challenged your administration, where we're at right now, a little bit about your executive orders and where those are going to play out over the next few months, and any words of encouragement you might want to give us as a small rural community still struggling to figure out what is best for us. So thank you for joining me today.
Thank you, Mayor. I really appreciate you having me on the call, and I am certainly been challenged like you have, like folks all across our state have. With it actually started in our state with these enormous tornadoes and great loss of life there. A few days later, we had first COVID case, and that was a very unknown situation at the time. A lot of fear, a lot of anxiety, a lot of decision making with no data. That was it certainly was different in March than it is today. And then add to that some of the civil unrest with protests and whatnot that have taken what was intended to be First Amendment rights and turned them into something else, certainly in some other parts of the country. But we've had a real challenge for sure. But that's what we're made to do, right? Every single one of us is to step into the challenge we have and move forward with them. I will say I'm really hopeful. We do still have a pandemic. We have case counts that continue to linger. We have, there are folks in our state that are losing their life to COVID every day. It's very sobering, and there's a reality to it. But there's also a lot of hope. I was just got out of my daily Unified Command group meeting where we put together Department of Health and military and TEMA, and we strategize every day about where we are and where we're headed. We kind of did a deep dive on the death rate per capita in our state. We're the 16th largest state. We're about the 41st in death rate per capita, which is it's really death rate is never an encouraging number, but it certainly has encouraged us to know that we have limited the loss of life in our state. We also are 38th in the country in death rate per 100,000 residents in nursing homes. We have an aggressive strategy for nursing homes. We started it early. So I would say you talked about the whole 7 months. We're way into this now. We know a lot more. We understand a lot more. Our numbers are going in the right direction. Our ability to treat is getting closer and closer. Our businesses are open. Our schools are open. Our economy is recovering. We understand a whole lot more about this virus. It's not as scary as it once was, and so I'm really actually very optimistic about not only Tennessee's future, but the future of the country, but specifically Tennessee's, in part because of some of the things we did early to attack this virus and to keep our economy open. We were the last state, one of the last states to shut down, and one of the first to open up, and that has fared well. Probably in all of our areas except our urban centers downtown that have continued to stay shut down in a large part and therefore have struggled. But the vast majority of Tennesseans are getting back to work and going back to school and living their lives with the awareness of this pandemic in place.
And thank you for that really ray of hope that we see now. And I'm not sure we've turned the corner yet, but we've made progress and we'll continue to make progress on a national level and a state level and particularly on a local level. I'd like for you to address our face mask mandates and the importance of wearing masks in order to mitigate this virus. I know it's been a struggle, it's been politicized, and I've received a lot of heat locally, but we did it locally to keep our schools open, and hopefully we're going to be able to continue to keep them open and go back to our regular school schedule. But we've used that as an opportunity to try to bring it to the awareness of every individual. That's a small part that you can play in order to keep things as normal as possible and to return back to some sense of normalcy when it comes to the schools and business and keeping everyone safe.
Yeah, you make a couple of points there that are important, and one of them is that masks have been highly politicized. There's no reason for them to be. They're not political. They're not political fodder, or information. But they do work, and they do show clinically an ability, obviously, to not spread virus. I mean, that doctors have been wearing masks all their lives for generations in this country for a reason. But people have to use common sense. There are places where they're needed, places where they're not. I think that one-size-fits-all mandates from the state are never a good idea. I don't think state mandates are the way to go. But and the reason I say that, and I've said this many times, I think people trust their local elected officials a lot more than they trust the state government. And so that's why I've given locals authority to issue mask requirements, because they know what their communities need. They know what's happening in their community. They know about the COVID spread in their particular county, and they know what their citizens want. And they also have the trust of their citizens because they were elected by the people in their county. So I think that. But at the end of the day, mandates don't get people to wear masks. Personal responsibility do, and we hope that Tennesseans, and we believe they are. We see it. We see it happening when people started. When masks became more and more and more prevalent across this state, then our numbers began to flatten out and turn and start to go down. It's pretty clear. You can look across the country and see that, but people should wash their hands. They ought to wear a mask. They ought to stay away. They ought to do this. They ought to do that. And then, if you do that, then you can play football on Friday night. You can go to a Vols game. You can go back in your businesses. You can open your schools. We can keep our state and our livelihoods going forward with just a few small things.
And thank you for that. Locally, my face mask mandate still remains in place to the end of the month. And I know we've been awaiting about what you're going to do about the next reissuance of executive orders and where that's going to take us. I don't know if you can share any of that with us today or not. What's the next step in your executive orders?
Yeah, so we haven't made final decisions about where we go with that. One thing we do know, our goal has been to any executive orders that are tied to a state of emergency. A lot of people view that as, well, it's restrictive or it's clamping down on something. The vast majority of of the items tied to our state of emergency are actually deregulatory items. So, for example, it allows a doctor to operate with telemedicine in certain circumstances where they were not allowed to before. It allows doctors to operate telemedicine across state lines where they were not allowed to do that by regulation before. It allows for the extension of driver's licenses. It allows for carry permits to not have to be renewed for handguns for the next several months during a state of emergency. It allows for a number of deregulatory items that you can't put in place, you can't disallow, or you can't lift those regulations if you don't have the emergency order in place. So there are a lot of really good things it does that that most people don't want to stop, at least in the middle of a pandemic. County commissions and city councils meeting remotely instead of having to come in to meet, that's only allowable if you have a state of emergency. Most of the restrictions to all of our businesses have been lifted. So, as you know, in the 89 counties for which the state controls health departments, we've opened restaurants, we've opened retail, we've opened every kind of business and taken all restrictions off of businesses. We never had a restriction at all, by the way, on any churches in this state. That was very important to me. But those restrictions have been lifted, and the state's open. It's now, there are a couple things. One is this issue of giving county mayors authorities to issue mask requirements. There are some nursing home funding issues. The other thing that's important to remember about state of emergencies is there's a tremendous amount of federal funding that is allowed into the state only when the state has a state of emergency in place. So that's another reason to consider keeping them, at the same time changing them to lift restrictions and mandates. So we're working on that. We'll have it in the next week or two.
And thank you. I know there's been a big discussion about the vaccines, and I've reached out to Dr. Piercy, but do we have a plan in place now for the distribution of the vaccine when it does become available to the public health department?
Yeah, I was on a White House call yesterday with Vice President Penn and Secretary Azar, and, you know, first of all, let me just say about vaccines that, you know, people will need to make their own personal decision about vaccines. There's a lot of talk about whether or not people are going to want to, whether there's going to be a mandate for vaccines. There won't be a mandate in this state for vaccines, and because it's a personal choice for people, and they got to decide if the vaccine's safe and if it's effective, and then consult with their doctor, make a decision. But we all know that there are going to be vaccines available to our state, and they're going to be very limited in number to start with. So we are putting in place a distribution model in our state to make sure that if and when we get a vaccine, we can quickly and efficiently deliver it. So the way it'll probably work, and the federal government will give us guidelines like this, but the vaccine will most likely be available first to elderly citizens in congregate living, so nursing homes, frontline healthcare workers, folks with particular comorbidities or underlying health conditions that cause them to be at high risk for death as a result of COVID. There will be priorities given to those who are at the greatest level of risk, and they will then have the option as to whether they want to take a vaccine or not. Once those priorities are met, then you begin to move down into the general population to allow folks to decide whether or not they would like to get it, much like the flu shot. But it'll be some time before that. No one knows the exact dates of this, but the earliest dates that any vaccine will be available will probably be in the month of November, if then, and those will be very limited to those with very high risk.
And thank you. I was on a similar call with Secretary Azar and Dr. Burks last week, and they shared similar information with the mayors as well. So it's good that you're able to share that information with all of our listeners today. One thing that's been a big challenge for us locally during this pandemic is trying to do our census count. And even though we've put together a census committee and we're actually working every day this week hosting walk-up events to get people registered for the census, it's been a huge challenge. And I know the deadline was shortened by 1 month. And for many of our workers across the state for the census, their last day is this Friday. Are there any plans for the state of Tennessee working with the federal government to try to make sure that we get everyone counted, or there's an add-on plan or an amendment to these plans in order to get everyone that we possibly can counted for obvious reasons?
Yeah, let me just say to Mayor, thank you for making a push. And you say for obvious reasons. Let's remind everybody why it really does matter. We get benefits, federal funding, allocations. For example, when the federal government gives out funding for something like COVID responses, and they give a few $1 billion to this state and some billion to that state and some billion to another state. Every time a federal program is administered, frequently it's attached to population numbers. And so a county, if they don't get a good census count, then there's not a good representation to the federal government for things like funding. It also determines the amount of representation we actually have in Congress. That's how you do that, through the census. So people think the census is there to kind of gather information about them. It's not. It's there to find out information about the people that live in Tennessee, so that we can, and they've been doing this for 100 years, so that we can have access to the things that our taxpayers deserve, because it's our tax money that we send to Washington in income taxes. And so it's not their money, it's our money, and it comes back to us for spending in things that are important to us, but it only happens if there's a good census count. We've worked really hard to, and you can give out on your show more information about how people can reach tn.gov and census information, and we're actually hoping there'll be an extension, but we're not expecting that. So people just need to get out there and make sure they sign up for this and register information on the census.
And thank you. We've pushed hard, but I know a lot of communities have been limited in their resources. We did receive a few grants that helped us market what we're doing, and the walk-up events that we're having this week was basically funded by some of those grant opportunities. So we've done media blitzes and given away T-shirts, and we've got signage up. So we're working as hard as we possibly can to help Tennessee count everybody. So
that's a good deal. Thank you for doing that.
And going forward, what do you see as our biggest challenge at hand today? What do you see as our biggest challenge facing us here, just almost on an immediate level?
I think we've got to get people back into. We kind of learned how to manage this spread of this virus. So people just got to keep. On the one hand, we got to just keep doing what we're doing. People got to, stay the course, not get tired of, being diligent about, social distancing and wearing a mask and staying apart from each other. That's how we keep the spread from happening. We've seen that. We've learned it. And we've got some really good practices in place. People are doing that in your community all across the state. So number one, we got to kind of keep doubling down on doing what we're doing. But number two, we got to get people to work. We got to get people back into schools safely and effectively. We've got to get back to the things that drive our communities forward. And we've got a significant number of people on unemployment. We've got to get them from unemployment to permanent work. We're doing that through the Department of Labor. There are a tremendous amount of resources for anyone who's looking for employment post-pandemic. We need to we have a Tennessee Talent Exchange. We have a lot of things through the Department of Labor and Workforce that are resources to help people connect businesses with workers and workers with jobs, and we got to get our folks back on the employment ranks fully. We're ahead of the rest of the country in unemployment, but we still have a long way to go. And so I'd say that's the main thing. That's the first thing we got to do, because when people's health is protected and they've got a job and they're providing for their family, then we're a long way toward being back where we need to be, at least from an economic standpoint. But that's what we got to do: is stay the course on COVID, but focus on economic recovery and development. By the way, just things like being hopeful about where life is headed. That's why I've been encouraged with schools being open. And by the way, we've been open for 5, going on 6 weeks, and have very few closures resulting from COVID, because we just teachers, superintendents, districts have done a great job across this state, and we're one of the first states to really effectively open up our schools in person for the vast majority of districts, and that's been a big success. So much so that we can, have high school football on Friday night. People can live their lives and move forward because we know so much more than we knew before. My encouragement to people is, get out there and live your life, and make opportunity for other people, and serve your neighbor in ways that you can, and we will, and at the same time, remember the things that keep us safe from a virus, and we will move this state forward and lead the country and show others how to do it. And it's happening in our state. We're doing it. We just need to put the foot on the gas.
And thank you very much for those words of encouragement. As we're finishing up, we want to thank you and your administration and all the work that you've done over the last 6 or 7 months to bring stability to what has been an upheaval in our lives. I just want to ask one last thing, and you can keep it short, but we're always asking what Washington or Nashville can do for Warren County. But I want to ask you, what can Warren County do to help support you and what you're doing?
You're a good man to ask that. Warren County is an awesome place. You got a lot of activity there economically and every other way. And by the way, I'm pretty excited about some of the things we're doing in the midst of this that are going to help rural communities. And I hope Tennesseans have figured out that rural Tennessee is real important to me. And our office from day one, from executive order number 1 to today, has been focused, has a big focus on rural economies, life in rural Tennessee. It's real important. We just took $60 million of our CARES funding, and we've dedicated it to rural broadband expansion. So I'm very committed to what's happening out there. So what I would say is, as I said earlier, stay diligent on the things that we got to do to keep the spread of the virus, because rural Tennessee's been hit hard recently. Our biggest number of death rates have occurred in the rural communities. It kind of resolved itself in the big cities, but it became a rural problem. The numbers are going down in rural communities, and that's really, really good. But just stay the course on the spread, but get out there and get our state moving forward economically. For those who are struggling to find work, let us help you find and connect to that work. For those who are creating jobs, stay after it, because you're changing people's lives. Keep doing what you're doing is what I'd say. And I'll tell you one other thing you can do for me. You can pray for the governor. I know that there are a lot of faithful people in Warren County. I know that the prayers of the has accomplished much, and I am grateful for the covering. I have so many people tell me they're praying for us, and Maria and I are very, very grateful for that. it is a challenging job navigating through this and making decisions. I ask God for wisdom and discernment every day, so I appreciate y'all's prayers.
And thank you very much for joining us today. And of course, we invite you and the First Lady anytime to Warren County to experience what we have to offer. I'm sure that when things settle down, you'll be putting us back on your schedule again, and we would love to bring you here and entertain you and show you some of the progress that you and your administration and Governor Haslam's has helped change the lives of so many people through investing in our community. So thank you very much. You have a great day.
Thank you, Mayor. We'll talk to you soon.
All right. Thank you, sir.
All right. Bye-bye.
Today we have other guests joining us for some updates with some valuable information to share with our listeners. We have Dale Humphrey, the CEO of River Park Ascension St. Thomas, and Grant Swallows, the Director of Warren County Schools.
Thank you very much, Executive Haley. Good morning. As he said, I'm Dale Humphrey, the CEO of St. Thomas River Park Hospital. Today, instead of just updating you on the numbers, I thought I would compare them to where we were just a week ago so you get some sort of scope of where we're progressing. From a state perspective, Tennessee has 184,409 cases, which is just over 10,000 more than last week. 166,000 have recovered, which is also just over 10,000 more than last week. We have had 2,233 deaths, which is 136 more than last week, keeping the death rate at 1.2%, which I'd like to point out is less than half of the national death rate, which is currently at 2.93%. As a state, we've performed almost 2.7 million tests, and Tennessee has had a 13% decrease in cases over the past 14 days. Warren County stands at 1,012 cases, up 47 from last week, and 73 more cases have recovered, bringing our total to 924 recoveries. We have had 7 deaths, which is a 0.7% death rate and is down slightly from last week. Warren County has had 13,450 tests performed, or 850 more than the previous week. As a county, we have also been trending down for the past 14 days, averaging 7.1 new cases per day. The previous 14-day average was 12.7 new cases per day. And over the last 7 days, our average percent positive of those that receive a test is 8%. At St. Thomas River Park Hospital, we continue to have positive COVID-19 patients present in our emergency department, be admitted into our hospital in the ICU, and we've also continued to see patients in our clinics. Just 3 weeks ago, we had double-digit numbers of COVID-19 positive patients hospitalized. Currently, we only have 3 positive patients admitted to the hospital. We continue to limit our visitors in the ICU, behavioral health, rehab unit, and emergency department to only those absolutely necessary, but we review the exceptions on a case-by-case basis. In addition, we're still requiring face masks to be worn by all patients, visitors, associates, and physicians, and we will provide you a face mask when you enter the facility. As Governor Lee mentioned, I want to continue to stress that wearing face masks is one of the most important steps that you can take to limit the spread of the virus. Today, I want to thank the community for your individual efforts to keep yourselves, your families, and our community safe by following the guidelines that are proving to be effective as our country strives to develop a suitable vaccine. We thank you for watching, and as always, God bless you and your family. And so next, I'd like to introduce the Grant Swallows, Director of the Warren County School System, and also congratulate the Pioneer football team on their 5 wins this season. Go Pioneers.
Man, for this time to be able to just to talk about football. I wish we could spend this entire press conference talking about that. I appreciate that. Congratulations. And do want to add my congratulations. But also, we have a soccer team that's having a great year as well. Volleyball had a big win last night at Shelbyville. And so I talked with some students at Warren County High School yesterday and talked to them about what a great year they're having, how I know it's different, but their attitudes, in my job, I feel like I need to go spend more time with them because the maturity that those young people are showing and all the different things that we're asking them to do. One young man said yesterday, My senior year is different, but my senior year is what I make it, and we're having a great year. And man, I wish we would all learn something from that senior in high school. What a great statement. I appreciate him so much. I appreciate the input that they gave. And so I do want to just thank the governor for recognizing our teachers and our school districts for the great work that's being done. Can I just say to you, it is extremely hard work. It's extremely hard work. It's a different year than we've ever experienced in education, and we're working really hard to try to serve our students and keep them safe. And we've done some great work in Warren County. We are meeting tonight. The regularly scheduled board meeting of Warren County School Board will be tonight at 5:30 p.m. at Warren County High School in the auditorium. That meeting is open to the public, but will be limited with the governor's executive order to the first 50 that show. We will welcome them and distance them. We would ask that masks be worn and all the distancing protocols be followed if anyone wants to attend that meeting. It will also be streamed live on the Warren County Schools YouTube page. So if you cannot make it in person, we would love to have you on to watch. I do want to update you on our numbers from this week and last week. As of today, we do have 19 students that are isolated because of a positive test, and we have 78 students that are quarantined because of close contact. Again, that is a great number. We don't want any sickness. We don't want any quarantine. But at the end of the day, based on the size of school district that we have, almost 6,200 students, that is a very low number, and that's a tribute to the great work that is being done in our school system. As I close, I simply want to say we have created great momentum in our county because of the great work that you've been doing. Our students have done great work. Our teachers are doing great work. Let's do not lose that momentum. Let's don't let up. Let's do the things that are being asked to do because our kids want to be in school. Our families want our kids to be in school. And guess what? We want our students to be in school. And so we've got to be able to continue to do the things that we've been doing and we're going to continue to do to make sure that we keep our students where they need to be. I appreciate so much your time, and we'll finish just like Dale said, go Pioneers.
Thank you, Mr. Swallows and Mr. Humphrey, for being team players. Your commitment to serve our citizens and our residents and your leadership throughout this whole ordeal has been exemplary. The hospital and their staff has done an exceptional job over and over again and being a big supporter of everything that we've done as a county in order to move this community forward and to mitigate this disease. Our school system, can't say enough about them. Part of the reason we did the face mandate was my team decided that it was important in order to bring the numbers down and stabilize the number of cases so we could get our kids back in school. And that continued effort with the support and the encouragement of Governor Lee today and from Mr. Swallows and Mr. Humphrey, that is how we will continue to make progress. That's how our businesses will stay open. That's how our kids will stay in school. That's how we will keep each and every person, particularly those with health challenges, safe and secure. So we want to give a shout out to each and every individual, each agency, every organization, every team player that's been a part of this winning formula. Next week, we're going to have Secretary of State Trey Hargett on our program, who will discuss about the challenges of holding the November election. And so we'll also have our local election commission director, Susie Davenport, to give us updates on what we're doing locally at the polling places in order to protect each and every individual who shows up to vote in person at the polls, as well as how mail-in ballots will be handled by our local officials. They did an exceptional job in August, and we're sure that the state of Tennessee will have another successful election in November, which is important to each and every citizen in our county. Now, with some local updates, our guard is still testing at the health department, so from 9 to 1 each day. And so if you're needing a test, you're feeling sick, if you've been exposed to someone with the virus, please take heed and take proper precautions and get tested. They're available. The Guard is there. Their service is important not only to Warren County, but the entire state of Tennessee. My executive orders and emergency orders will stay into effect until the end of this month and will be renewed upon the authorization from Governor Lee, who spoke earlier today. The decision has not been made yet about extending his own executive orders. County offices remain closed to the public on Monday, Wednesdays, and Fridays. We are looking at opening up another day. We've got Tuesdays and Thursdays open to the public for walk-ins, but you can always call the individual offices, set up appointments. Every employee has been working. Every employee has been providing services. Every single deed has been recorded. Every essential service that government can offer, both on the city and county level, have been continuously provided throughout this ordeal, which is more so than several surrounding communities who've had complete shutdowns because of COVID cases. So we will continue to monitor and continue to protect our employees. Without them and protecting them, we cannot provide services. So it's important to me, it's important to you, it's important to our entire economy and entire community that we keep these offices open. Our team is evaluating the numbers daily, and so we are looking at what comes next. With the direction from the governor and my preparedness team, we will make plans for maybe more reopenings of government offices in October. Until then, once again, all essential services will continue just as they have since March. Once again, call ahead if you've got questions. Call my office at 473-2505. If you've got any kind of questions or seeking information about a government service or what's coming next. In the meantime, we will continue to work together and mitigate and contain this virus. Your efforts are very much appreciated. Everything that you have done in support of keeping our kids in school, our businesses open, and all our residents safe has been extremely important. Emphasizing those guidelines again that the governor did earlier. Once again, wear the masks. They are effective. They should not be politicized. Do your social distancing when at all possible. Use a little common sense in everything that you do, in every place that you go, and in contact with everyone that may have a health challenge. Keep it clean. Use good personal hygiene each and every day. And so hospitals have been doing it for years. Nursing homes have been doing it for years. Health departments have. School systems have. We will continue to do that because it works. In the meantime, as those guidelines are followed, and as our recommendations are applied across the county and across the state and across the nation, we hope that some sense of normalcy will return. It's a simple formula for success. Everyone being a team player, everyone do what is right, everyone do your small part. And in some cases, there's very little more that you can do than those simple guidelines. It's a simple fix, and we know it works. Every day, we're making progress. Every day, we have something new that falls into our lap that's a new challenge, but we meet it with success. We have in March, in April, in May. It does make a difference in what you do. It has made a difference, and it will continue to make a difference as long as we work together as a team. I want to leave you with another quote from Winston Churchill, one of my heroes. And he said, "Every day you make progress. Every step may be fruitful. Yet these will stretch out before you in an ever-lengthening, ever-ascending, ever-improving path. You may know you may never get to the end of your journey, but this, so far from being discouraging, only adds to the joy and the glory of the climb." Thank you, Warren County, for your perseverance and determination as we move forward together in our quest to basically meet this challenge. We've come far, but there's more hurdles ahead. We will not get discouraged. We will still instill hope and be empowered by the opportunity to take advantage of these challenges and basically rise as a community to be bigger and stronger and better together. This basically is a rallying cause to be united in our efforts and support those that are doing their best and the leadership that's in place from the national level, the state level, and local level to bring things back to normal as soon as possible. So thank you, Warren County. Thank you for being a team player. Thank you for your support. Together, we are Warren Strong.